we're going to start our ninth nutrition policy discussion, which is started after COVID-19 came to Bangladesh. As our understanding in Bangladesh, like we first got the first cases in Bangladesh in 8th March 2020. Now we have closed more than 100,000 cases in Bangladesh. Lots of people are affected during this time. Government taken lots of initiative like lockdown, social distancing, other things. But people are not able to cope up with this. Nowadays, urban areas in Bangladesh mostly affected, and poor people lives in these urban areas. Our observation is that food price and access to food is a big problem. So we thought that maybe nutrition policy discuss a way to give a recommendation to the government for taking different initiative for maintaining the good nutrition in our country. Today we have got two guests to discuss about this nutrition policy discussion developing countries. And we got our two speaker, Professor Ted Gaynor, Editor-in-Chief, Journal World Nutrition, World Public Health Nutrition Association. Ted, welcome to you to our policy discussion.
Thank you, Shamim. It's a pleasure to join you.
Then we have our second guest speaker, Emily Levitt-Rupert. She's an independent consultant and Agriculture Nutrition Committee of Practice. And she did lots of work in developing countries. She was in Afghanistan. Emily, to this our policy discussion.
Thank you very much.
Emily, let's start our discussion. First, we want to that what is your understanding regarding how nutrition will be affected in developing countries during this COVID-19 pandemic situation?
All right, I will begin by sharing my screen. Is everyone able to see the screen? Let's see. All right. When I thought about answering this question, I thought about my training in international nutrition and how the complexities of nutrition can be organized through this UNICEF framework that we've had since the early 90s. And what I wanted us to touch on in the course of our discussion today, and the way Ted's talking points touch on these different domains, I think it will be helpful for listeners and policymakers to be able to organize their thoughts according to this framework. For those who aren't familiar with it, at the top we have malnutrition. It is affected by both diet and our health status. In this case, we have already the existing infectious diseases in the population, especially diarrhea and acute respiratory infections with young children. But now we have the COVID-19. And then we have diet, which has varying characteristics depending on age and urban, rural, seasonality, and wealth, and all of that. So right now we have a lot affecting our diets, and the health status is affected. What's interesting about COVID-19, as I was thinking through this analysis, is the vulnerable groups are not so much the same as we're used to seeing in our malnutrition work. Often we look at women of reproductive age and preschool age children. interestingly, in developing countries, the population is so much younger that the caseloads may be high in some places, but the vulnerable groups are different, people with pre-existing conditions and the elderly. And so we're just not seeing the same affected populations as we typically do with malnutrition. The children seem to be more protected from this virus for some reason. So that's an interesting dynamic within the household, that our attention is typically on women and children, and now with coronavirus, our attention is typically towards these older or more health vulnerable groups. And so those health vulnerable groups and older folks may be those who are helping with income generation, and that is a challenge then as we get into some of these other resources for the household in the lower domains. This is an adapted framework, but we also have maternal and child care below diet and health. We know that the caregivers are affected by whether or not they're ill, if they're having to be quarantined. Ted's going to speak about that in breastfeeding and correcting any misinformation that may be out there, because that's a really critical point, to not isolate infants from their mothers. And then we have the agriculture sector side, where we have agriculture, production, and household food security, and health services and health environment on this side. And in the middle, I like to put the household capacities. What knowledge, skills, and resources do we have to deal with our challenges, our needs to obtain healthy diets, proper care for women and children, and to obtain good health. So we have an adapted framework here from what people might normally see, but this is how I've wanted to think about it today. And a few other points I wanted to mention were in food security. We'll talk about this more in a little bit, but there's quite a lot of disruptions to markets with the road shutdowns and border closures. So there's an effect on supply. Food security, we know, relates to food availability, access, and utilization. So we have serious constraints on availability right now, and access if people need transportation to get to markets and they're restrained from either taking crowded public buses or other types of transportation. There's also an opportunity for a greater localization of the food system, which I look forward to discussing in more detail. So I think while there are a lot of challenges with coronavirus, COVID-19, there's also a lot of opportunities to address problems that we've had in the nutrition system for decades. And we'll touch on this again later, but there are more mouths to feed now in the households with people not leaving so much, but being constrained to be at home, and how people are finding food to address that. In the health sector, there's a greater strain due to the caseload, and yet more people may be avoiding going to facilities to avoid getting COVID-19. So if you have a minor condition, you may be avoiding going. With children and women, if there's a need for services during pregnancy, there may be more home births, there may be less use of antenatal care, iron folate supplementation. We may see less use of facilities for children who are ill and not get the necessary oral rehydration they need at a critical time. So we may have more child death because of underutilization of services. And I think the biggest area that we may want to think about for intervention would be the wash area. Hand washing with soap, and how we can make that possible for people, because we know that there are still a lot of people globally without access to clean drinking water and water close to home. So how do we facilitate that and availability of soap for people? I think that's a low-hanging fruit opportunity, and I'll stop there.
Yep. Good. Can you hear me? Did
Yes, thanks. I hear you.
can, can what would be the impact of COVID-19 on nutrition in developing countries?
Let's see if I can get this to work here. This is my first screen. Here we go. Um, I can't even read it all myself. But anyway, how can I? Oops. All right. So as you can see on the screen here, the World Food Program has warned that the number of people facing food crises could double due to the pandemic. So a recent upper assumption of a 50% relative increase in wasting was used in a recent Lancet simulation of the indirect impact of COVID on health, resulting in an increase in wasting um, that's expected to account for 18 to 23% of additional child deaths due to COVID. At this level, over the next 6 months, there could be over 1 million additional child deaths and over 56,000 additional maternal deaths indirectly caused by the COVID pandemic. And this is, of course, all going through nutrition. There'll be other deaths, of course, due to COVID itself and other indirect effects. As Emily said, the impacts on the health sector are probably quite substantial. As with any infection, COVID is going to be worse and more dangerous for people with poor nutritional status in general, or those suffering from certain nutritional deficiencies. Most of the attention has gone to obesity and associated non-communicable diseases because they're known risk factors for COVID, and most of the global attention is being driven by developed countries' concerns. Let's look now at the issue of threats to food consumption. The issue that Emily is going to address, as she's already begun talking about, is availability. If it's disrupted too much, then that's where we're going to see horrible large-scale famine. But the second disruption is on the demand side due to reduced income. So far in most developing countries, unemployment is increasing mainly in urban areas, but gradually lower urban incomes is going to result in lower rural incomes for people who are not just doing subsistence agriculture because they are pretty much independent of what goes on in the economy as a whole. Half the global workforce is outside of formal employment arrangements, and thus is at increased risk. In many countries, government benefits that are being paid out for COVID are going to people who are in the formal workforce. As long as the situation, the nutrition and COVID situation progresses slowly, as it has in Africa and many other developing regions, it's likely that people who are able will make adaptations and plan for contingencies in such a way as to minimize harm to food intake and hunger in the sense of calorie deficiency. They may be strengthening family and community-based safety nets for themselves. Let's hope so. Another potentially useful change would be an increase in home cooking. This generally is known to result in healthier diets. At least among people who often eat out, home cooking will increase. Home cooking in developing countries is likely to focus on basic ingredients like staple foods, beans and legumes, and some kind of vegetable-based sauce or relish, with small amounts of animal foods as they're available and affordable. In most developing country contexts, eating out may not be common anyway, or it may result in a diet that's a little different from what's eaten at home, though home cooking could well save money It will often contain fewer animal foods, which is useful for people who already eat too much or are suffering from overweight and NCDs, but not necessarily useful for people at the extreme end of poverty. There may be reductions in home-based food wastage, but again, differences may be small in most developing country contexts where there's probably not a lot of food being wasted anyway. The biggest problem, I think, all over the world is going to be consumption of fresh foods, which will likely decline, especially in settings where refrigeration is lacking. And therefore, people with traditional and still existing food preservation techniques like fermentation and food drying will benefit by ramping those up. Non-communicable diseases, NCDs, are now widespread in most developing country settings. Many people will reduce or avoid their normal contacts with healthcare settings out of fear of catching COVID, as Emily referred to, and this could result in a reduction in secondary prevention of NCDs, causing diabetes, high blood pressure, and other conditions to worsen more rapidly than they were doing before the pandemic. Dietary shifts may also speed up the incidence and seriousness of NCDs. Why? Partly because of an increase in consumption of ultra-processed foods. We don't have much evidence to go on. The SCN, that's the remains of the old Standing Committee on Nutrition of the United Nations system, did a study on a convenience sample of mostly nutrition-involved people and found that after work and social engagement, food issues were the most disrupted by the pandemic. They found that where possible, people stockpile food. Which food are people going to stockpile? Likely it's going to be packaged food and canned foods. And this in turn will increase the consumption of these. Not all canned foods, of course, are ultra processed, but most packaged foods are. The seeming advantages of ultra processed foods in developing country contexts that will likely lead to higher consumption are that they may seem to be low cost per calorie if you take all the further advantages into account. They may be easier to obtain or purchase than many other foods. They're often present in local small stores, and they don't require expeditions to purchase fresh food in possibly risky locales. They, from a food safety point of view, have less risk of food poisoning or diarrhea, especially than animal foods. They can be stored for long periods with no refrigeration. There's no time-consuming or fuel-intensive preparation required, and they may serve as comfort foods for people who are living with increased anxiety or stressful conditions, especially young children, who parents may calm or comfort by giving them tasty, often sweet foods. Okay, that's it for me for the first question.
Yeah, thank you, Ted. Let's come, Emily. Emily, what is your understanding that, what will be the challenges for the poor people and farmers during this COVID-19 pandemic situation?
All right, thank you. I'm going to share my screen again. I enjoy tackling the farmer side here. Trying to, is it large? Okay. Okay, there we go. There we go. All right. So I was mentioning I'm very interested in the whole connection between agriculture and food systems and nutrition, and I appreciate that Ted is also very much an advocate of food-based solutions, because that is the ultimate sustainable approach. So on the side of the poor and farmers, some of the poor, as Dr. Talukder mentioned, are in the urban areas. So we're not only speaking about the rural poor, but rural and urban. What we're finding is that one of the challenges for everyone worldwide is staying healthy. We are quarantining sometimes, but how do you quarantine when you have a 1 or a 2 room house and there may be 5 to 10 people living in it? Home is a busy place, so that's a challenge. People need to innovate to allow for quarantining, perhaps affected or infected or potentially infected people all going to a particular place so that other family members are more at risk, people more at risk of getting sick. If they're older or have an underlying health condition, may not be in the same place as the person quarantining. So people may need to get creative. And that can have some cultural challenges depending on the culture. And then gender issues as well. But there's always a way. The social distancing can be difficult in these circumstances. Everywhere, people are finding that children are now more at home than at school. Ted is also going to mention that school feeding programs should continue. Children were often fed at school and they are now missing that meal. So how do we maintain that intervention even if classes are not being held? There are some countries in Europe that are continuing to provide school lunches. So we could learn from that example. I know here, even in my neighborhood, families do come around to the school to collect a food basket for some period of time, even if it's not daily. And I'm in Maryland, outside of Washington, D.C. Children are losing educational opportunities. There's limited computerization as there is in wealthier areas, so children are not being given a laptop in the developing world, presumably, to be able to continue classes over Zoom, as is happening here. There is a pressure on food stocks at home as people are sharing the foods available at home more so than usual. If some members of the household are used to migrating out to work, either for the day or for a week or more at a time, people are now at home more together. If there has been a store of food for the family to last multiple months after a harvest, that store is getting tapped earlier than normal, and finding ways to address that through food security monitoring is an important activity for some of our next questions that we'll address. Domestic violence risk also increases with the stress of crowded and stressed people all at home right now. So psychosocial interventions are important to think about as well. Access to hand washing with soap, safe food preparation, and cleaning foods that are acquired from outside. Income earning opportunities reduced is one of the hugest impacts we've found of this pandemic. People have lost their jobs, they've lost income, and remittances from abroad. Here in the United States, there are an enormous number of people who've lost jobs and they had been sending money back to other countries. So wherever your income is coming from, it may be dramatically cut right now. There's limits on labor migration, ability to travel. People who are driving taxis may choose not to reduce their risk, and buses are a high-risk place. Food sellers are losing customers from day laborers and migrants to urban areas. And people are choosing also to sell food in different ways to reduce their own risk of being in a crowded marketplace. Another challenge is farmers are having trouble getting foods to markets, especially perishables, fresh fruits and vegetables. I'll mention cold storage as an important thing as an intervention to support farmers. Accessing markets and services if transportation is complicated. So it's harder to get the foods you want, but other services too, like health, education, extension, even veterinary services may be more challenged during this time. There's not as many online markets in developing countries, although they are there, especially with smartphone technology and community sites, perhaps, where there are some computer services. A lot of people in wealthier countries are choosing to do a lot of shopping from home and having things delivered when possible, but that's not as possible elsewhere. And then transportation, again, is a challenge. There are, however, opportunities that this crisis is giving us. Being together, I didn't put it as a bullet point, but it's wonderful to be together with family members if there is not domestic strife. And greater family connection can be a benefit. Also, more assistance to women with childcare is to free up women's time to do other things, income generating or otherwise. An opportunity exists for technology to be used for communicating to improve monitoring and availability of nutritious foods and food prices, health and nutrition to support farmers in the rural poor, and even in urban areas. We can use the individuals in the population can work together with local governments to communicate about what's going on in markets and availability of foods and the price of foods. And then governments and partners can work to address gaps. Health and nutrition services also, with the technology people now have through cell phones, mobile phones, we can try to identify where the problems are and focus our interventions where the need is greatest. And with multiple people reporting, there's also an ability to fact check and make sure that the data is accurate if it's coming from multiple sources, individuals reporting the same thing. And the return to localized food systems is something that I think is a huge win for this pandemic time. That whether you live in Maryland or you live in rural Bangladesh, we have an opportunity now to revisit the use of local foods, wild foods. There have been people in the nutrition community for years calling out for utilizing traditional foods, wild greens and things that we want people to eat because they're very healthy, but maybe not as exciting as a bag of chips or something, or packaged foods, highly processed foods. So now that those are harder to access, more expensive, perhaps people out of desperation may turn to rediscover locally available food resources. So I'll end there.
Yeah, Emily, thank you. Ted, can I come to you and in developing countries can act to manage this nutrition problem during this in Bangladesh?
Yes. Can you see my screen? I've kind of lost, it looks like. I can't see the Zoom room. Can you see my screen at least?
Not yet, but I can put yours up if you'd like.
Okay. I'm a little concerned about the fact that I can't see you guys at all.
We can see and hear you.
Okay, here we go. I'm going to get back to you and share screen. Okay, are we back on track now?
Yes.
Okay, good. So let's look at the issue of government responses to the issues. Again, I'm focusing more on the demand or consumption side, whereas Emily's focusing more on the supply side. Withdrawing attention or funding from nutrition and nutrition programming due to the needs and the economic requirements of the COVID emergency will be counterproductive because of the interactions between COVID and nutrition. Indeed, nutrition programming needs to be strengthened just to keep already unacceptable levels of malnutrition constant, because with each 1% drop in global GDP, we expect to see a 0.7 million or 700,000 increase in the number of cases of nutritionally stunted children. Dietary diversity requires additional attention by government, as many measures taken to reduce the risk of infection, such as lockdowns and social isolation, may also reduce availability of less often consumed foods, and especially fresh foods. Income transfers and employment benefits are critical. Unemployment benefits are critical to maintaining the health of individuals and of the economy. A focus mainly on the supply side, like the United States is doing, is doomed to failure. Food subsidies can be an important part of protecting incomes and preserving public health and nutritional status, but over the long run, attention should be focused on a balanced diet, not just on maintaining calorie consumption, which is what food subsidies usually do. Consumption of a balanced diet means in the sense of both nutrients and non-nutrient health-promoting factors in food, such as fiber and polyphenols. These latter non-nutritional ones will suffer if government and donor responses focus too much on nutrient supplementation and fortification. Now that NCDs are such a serious problem in developing countries, food-based solutions must be considered paramount. Nutrition expertise should be included in national COVID response teams, and their input should be scheduled for all relevant meetings and public presentations. Governments should adapt nutrition programming as needed to reduce COVID transmission risks, for example, moving most meetings to digital forums. They should be wary and maintain a response capability as the junk food industry attempts to exploit the situation to increase consumption of their products, which is already probably happening anyway. From what I hear, they're very happy about it. They have no place in government policy-making settings. I'll get to that later. They're not stakeholders who need to be included. Their only role is to be informed and held accountable to respect relevant government regulations and restrictions on their marketing practices, such as bans on junk food advertising to children. Existing nutrition surveillance systems should be strengthened and used to help judge how needs for nutritional health under the support are changing in different locations. It's easier to measure changes in nutrition than many other changes in society, and therefore nutrition surveillance can often be the canary in the mine, so to speak, the spearhead. Governments, especially in the poorest countries, may give inadequate attention to obesity and NCDs, unaware that they now, too, are nutrition problems of poverty, no longer just rich man's diseases. Governments may want to consider making access to drugs needed to control NCDs easier, lower in cost, and free from prescriptions, at least temporarily. That's already the case in Brazil, where I live. The only things that require prescriptions are antibiotics and psychoactive drugs. So people with diabetes and asthma and other chronic diseases can get their drugs without having to go to a doctor every month. Alcohol consumption needs attention, even at policy level, for example, increasing taxes on alcohol, because COVID may lead to increased consumption and, of course, many other reasons. COVID is forcing people into stressful quarantine situations at home and causing loss of jobs and income, all of which increase the risk of excess consumption of alcohol, especially by men, and as Emily referred to, this in turn can feed into problems with domestic violence. As for any and all activities these days, nutrition programs have to take COVID risks into account, changing methods of working accordingly. In addition to ensuring that both providers and beneficiaries use masks and hand sanitation, social distancing will require many adaptations in nutrition service provision. Any activity requiring close proximity should be revised where possible, with the goal of keeping the time of close proximity to a minimum. Thus, for example, parents can be instructed under observation to carry out many anthropometric measurements with supervision. Questionnaires or information for required record keeping can be obtained at a distance instead of sitting close to each other, taking necessary steps to reduce ambient noise interference that prevents that distance from being possible. Food and other items provided to beneficiaries need not be personally handed to them anymore. Personnel who must remain close to patients, like dentists, and their importance in nutrition receives far too little attention, will require substantial investments to reduce risk to the service providers. I understand that dentists often are having these spacesuits, for example, which doesn't just eliminate the risk to them, but also to the beneficiaries of the patients. Where food availability is greatly changing, education on safe food preparation techniques in the home may become an even higher priority. Governments need to manage COVID information because misinformation is getting out there so quickly, particularly to people who have access to the internet. Government and professional nutritionists should maintain watchfulness for false or misleading information about food and nutrition in relation to COVID. The most harmful misinformation in many locations is currently the assumed need to separate mothers and infants at birth and or to avoid breastfeeding, as Emily already referred to. No foods, nutrients, or supplements are proven to protect against COVID or to cure COVID, although actual nutrient deficiencies will, of course, increase people's risk. In each setting or country, information should thus be provided on food-based approaches to prevent common nutrient deficiencies and the role of safe exposure to sunlight in preventing vitamin D deficiency, which probably is very important in COVID, although we don't have good research on any of these issues. As Emily mentioned, school feeding somehow has to be given attention in places where schools are closed, which is most of the world. School-aged children need nutritious foods, and those needs, if anything, are greater now. Innovative methods for ensuring that they continue to receive this food are being developed in several countries that I've heard of. As for many services, where possible, home or other safe delivery mechanisms are needed, as many parents will not want to venture very far from home every day, nor do they want their children to be unsupervised, either in or out of home. Now I'm going to talk about infant and young child feeding, which of course is impacted by COVID, but I'm going to talk about it from the perspective of what it should be, which is what governments need to be paying attention to. It's well known that groups with the highest risk for nutrition problems in general are pregnant and breastfeeding women and children under 2 years of age. That means the first 1,000 days. And as I mentioned, it doesn't get much attention because most of the attention relates to developed country problems, but nutritional deficiency is almost certainly putting people at greater risk of COVID, and the research needed to find out how much risk isn't being done because most of the research related to COVID is done in wealthy countries. Thus, nutrition programming has to continue to prioritize the first 1,000 days. By far the most important component in good nutrition and health is breastfeeding. It protects both the mother and the child from numerous diseases and enhances the nutritional status of the infant while requiring a modest improvement in the mother's diet. Optimum breastfeeding includes early initiation within the first hour of birth with as much skin-to-skin contact as possible. That doesn't have to be with the mother, it can be with the father to, or other people. Avoidance of common, traditional, so-called prelacteal feeding practices and colostrum discarding needs to be given attention where they're present. Continued exclusive breastfeeding should continue till 6 months of age, that's 180 days. Continued breastfeeding with appropriate complementary feeding should continue up to and beyond 24 months. Because COVID places mothers and infants under increased risk, both due to health and economic or food security threats, breastfeeding should be continued longer than under less threatening circumstances. If any emergency, food disruption, need to emigrate, etc. occurs, breastfeeding is food security for infants and even young children. Because even if a toddler is only receiving a small amount of breast milk a day, they will return to the breast repeatedly for comfort in stressful times. The increase in suckling that results will cause an increase in breast milk production, and the toddler's need for food, safe water, and nutrients will all be fulfilled to a large extent within a couple days of this change in toddler behavior. Breastfeeding provides disease protection in ways that no food can do, not just because it's clean, but via numerous immune system processes. If the mother is exposed to some disease, for example, if some new disease comes into a community, antibodies to it will in most cases quickly appear in breast milk. We have no research to show whether that's true for COVID, but it's certainly true for viruses otherwise. Existing guidelines for complementary feeding should be followed. Where certain foods normally used as complementary foods are unavailable, nutritionally comparable substitutes should be used where possible. When access to nutrient-dense foods is limited, increasing breastfeeding will help reduce the harm done to nutritional status of the infant or toddler by reduced consumption of such foods, nutrient-dense foods. Infants and toddlers should not be fed with ultra-processed foods, which means commercial infant foods should be avoided to the maximum extent possible. There's already a huge problem that's not being addressed in developing countries, with toddlers being fed biscuits, sweets, and other foods that are either high in sugar or salt. When toddlers are psychologically stressed, such foods should not be turned to as comfort foods. Breastfeeding is almost always a comfort food to all toddlers and should be used for that purpose where the need is evident. Mothers with COVID should not be separated from their infants, either at delivery or at any other time. They should be instructed in wearing a mask when they're close to their infant, and to properly washing their hands before each time they touch the infant. This is true whether they're breastfeeding or not, so it has no implications for breastfeeding. In fact, a non-breastfed child, because they're often fed by other people, could be at greater risk from a wide range of people touching and feeding the infant, some of whom may not understand the importance of hand washing as well as the mother does. There's no evidence that babies can catch COVID through breastfeeding, and giving its life-saving effects, especially under uncertain and risky circumstances, breastfeeding should be protected, supported, encouraged even more than it was before. Communities should be assisted to develop mechanisms for infant care and feeding where maternal deaths are increasing, where possible to include breastfeeding or breast milk feeding. Methods for relactation, such as drip feeding, should be taught to health workers and responsible people in the field. That's a bit new, at least for me. But it is possible to have the baby sucking at the breast and to have a spoon with a little breast milk or a little formula in it that's dripped down so that the baby's getting that while they suck the breast, which will then result in the breast producing milk within a few days. Okay, that's it for question 3. Question 2. I got 3 and 4 backwards. Sorry. That's it for me right now. Over to you, Shamim. I think, Emily, can you hear me?
I can.
I think Shamim may be having trouble with the internet. Why don't you go ahead and
Sure, I'll go on. Our third,
your third question, yeah.
while I pull up my screen. Here we go. I'm going to share my screen. Would you read the third question?
I don't remember it. Sorry. See if I can find it here.
Oh, I've got it.
Okay, I do too. It's the impact of COVID-19 on food prices and quality of food in developing countries.
Sure. Thank you. So here I have a picture of a busy marketplace. It's not as congested as other marketplaces might be, and you'll notice that it's exclusively men. This is in Afghanistan. But we also notice how common it is to have food out and exposed to respiratory droplets. So we mentioned food safety issue when we were talking about risks to individuals in the previous question. So thinking about food safety is important in terms of our food system, food quality. With food prices here, as we look at markets, the supply is getting reduced because of road closures, blockages to border crossings. So the prices are going up. I've been in contact with colleagues in Afghanistan who are part of the Afghanistan Institute for Nutrition and Home Economics, which is a new institution. And they have been remarking, as have other colleagues there, that prices have gone way up, multiple, 3 times price of wheat, for example, in some parts of the country. So even staples are being significantly affected, and there are interventions that governments can do to help reduce that cost burden on the poor, especially. So making sure that staple foods, and we want people to eat a diverse diet, but making sure that staple foods are also affordable is an important thing for governments and nutrition policymakers to take into consideration. People are focusing more on basic foodstuffs. Will this lead to reduced dietary diversity? We don't know. That's an area for research. We do know people are relying more on what's locally available, which can be a good thing, but there also could be limited variety in what's available locally. Markets are typically full of a variety because of foods that are imported from other regions in the country or other countries. So when that is limited, especially in remote areas, what are we dealing with in the local food system? We also know that agricultural areas in developing countries often focus on particular commodities. You may have in Uganda a banana growing region that produces bananas and plantains aplenty, but people are largely selling that crop and purchasing food in markets. So the local agricultural system is not providing the diversity of foods that locals need to eat on a daily basis. So people are market dependent, and with those market disruptions, people need to survive on more than what they grow. So thinking about diet diversity is key right now. Food value chains are being disrupted because different steps of the chain may be shut down, factories may be closed, production facilities closed. So foods, we may be dealing with more raw foods, fewer processed, hopefully in a good way, foods, in the sense that a raw food from a rural area may not be transformed down the food chain, the food value chain so much anymore. So we'll have interruptions in that. And with the resulting consequences on those who depended on income from selling those other foods or producing them. So people at all different levels here are affected. Increase in the use of packaged and processed foods. Ted has spoken about that. Foods are being stockpiled. I know I'm trying to shop, a month at a time, buying lower cost things so that I don't have to frequent the grocery store. So to the degree that people can do that, they may be trying to, if possible, buy lower cost foods that will last them longer, that are not perishable. I think Ted did mention from the same SCN report that these highly processed foods are not good in combination with more sedentary stay-at-home lifestyles. That's all I have for this question.
Shamim, do you want to read the next question?
Yeah. Can you just, share with us that what should be the role of UN as well as
Right. Okay, so I'm going to talk about the role of donors. There's not a whole lot to say, but I'll say what I can think of. As always, donor agencies, outside NGOs, UN agencies, and others should work closely with government to ensure that their actions are in line with evolving local priorities and requirements. Capacity building, like always, should remain a priority. That means that donors and NGOs and others should not come in with their own people and do the work that can and should be done by local people. Instead, they should help train and empower and finance local people to do the work. Greater attention should be focused on fundraising, because the impact of the pandemic is doing so much harm on government's economic status, especially in small countries that are unable to borrow money, and below national level in almost any country. Borrowing is difficult or impossible, so that budgets are very constrained right now. And any financial assistance from outside is going to be helpful. Donors themselves may be changing how they work because of travel restrictions. This may mean more digital meetings, but also it can impact on getting their personnel into and out of developing countries. One of the problems that we have is donor agencies giving foods that aren't welcome. They should be asking governments what they want and need, and not simply dumping the foods that are available. Unfortunately, the United States has for decades intentionally given foods to developing countries that are surplus in the US, and then often create intentionally again dependency on importing those foods from the United States because the developing countries can't grow them. Wheat is a good example. But even worse are charitable donations of commercial infant foods. The big NGOs know not to do that, and the UN agencies and so on would never do it in recent decades. But some small charities or religious charities may not be up to date. And baby food companies, of course, are always trying to give away something for free, because that's the best way to get people to start buying your product when the free stuff runs out. So that haphazard contribution of commercial baby foods or infant formula should never be allowed. Governments must clearly express their needs and be assertive with outside agencies to ensure that donations of unwanted products directly to communities does not occur, and where found, there should be some accountability. Communities should be protected from exposure both to these products and to messages or promotion related to them. Health providers should keep these kinds of foods, these baby foods if they exist, stored out of sight and use them only in necessary circumstances and ways that don't reveal the brand names and don't risk unintentionally endorsing them. Okay, that's it for me for that question.
Okay. Emily, can you also share that what should be the role of UN and donors to manage this nutrition issues? In our country, in Bangladesh, if you look at that, the role of donors little bit most of the donors, they have left this country. So I'm coordinate with our national organization as well as government. So what is your understanding? And how do you like to see them to act during this situation?
Thank you for this opportunity to discuss this as we wrap up our hour. I think that donors, when they want to tackle the issue, can again go back to that UNICEF framework, thinking about food, health, and care constraints. I have pictures of hand washing here because while it's very easy if your home has a running tap with running water, there are a lot of people in the developing world who do not have that. And the best way to prevent the spread of COVID-19 is to wash your hands. And then with the masks to cover your faces. So, distributing masks or supporting local initiatives to produce them and have a handicraft income generating small business available is one opportunity. That there could be resources made available to purchase the materials to produce masks. I know people here in Amish country, Pennsylvania, where people live very traditionally, made, I think, $10,000 or $20,000 one weekend selling masks to the public, people who are not capable of doing it themselves. So that's just one thought. But also I have a picture here of a northern Afghanistan village where people are using a pump donated by the European Union. So I think we need to continue to make sure people have access to clean water. I think that's one of the number one things that I mentioned earlier in my presentation. It's just still shocking to me that a lot of people do not have access to clean water. All right, so if we look at the food, health, and care domains for the health systems, health environment, in a health facility, I know I think about this as I go for a dental exam or for another activity. You need to separate people with coronavirus, ideally for treatment, from those who are going into a health facility for some other reason. So health facilities, there can be a policy to help provide a safe separation. And then there needs to be protective gear and equipment for the medical personnel who may need to go between these spaces and don't want to infect people on both sides, because there's always inadequate medical personnel in developing countries, in my experience. There needs to be support for effective treatments and prevention measures as the science reveals these. And governments, as Ted mentioned and Shamim has mentioned, there are constrained government budgets. So outside support for that is helpful, whether it's equipment or medical resources. WASH, I mentioned. Public-private partnerships could be useful for soap, accessing more soap. Hand washing campaigns, distribution of face masks, I mentioned that. Social and behavior change communication with champions. What I find useful about this COVID-19 situation, or useful for addressing it, is that we have a lot of previous experiences to draw upon dealing with a shock to our system. We have good strategies. Social behavior change communication can be used with a UNICEF ambassador, a sports hero, to promote social distancing, wearing a mask, promoting correct science that Ted referred to. Some figureheads, even presidents, are not wearing masks. And so for their own reasons, they're choosing to not do that, although we would prefer as the scientific community that people did follow the best practices. So we could have heroes, local heroes, promoting best practices. That's something our donors, nonprofits, UN are very familiar with how to do all that. Food security, we need to support nutritious diets. I did discuss at length how we can use technology to address gaps. Colleagues and I in the agriculture nutrition community of practice are very excited about the opportunity here for more of a local analysis of what's lacking, so that food security work doesn't only address staple grains, but now really looks at, are we eating a diverse diet? Anna Herforth and some colleagues, she's based up in Boston, she's independent. She is doing a big survey with Gallup World Poll, looking in the coming year on global diets and availability. And we will soon have, hopefully, tools for assessing availability of diverse diets at the local level, and for food security analyses, and not just do people have enough grain or staple grain. Intervention can be helpful with safe handling of foods and food safety guidance. Cooking, if people are doing more home cooking, as Ted mentioned. Where it's difficult to obtain adequate fresh foods, typically outside assistance has been useful with supplementation. With COVID-19, we know that there's at least one more year of crisis to plan for. So while we're waiting to get to the other side of this, to solutions and prevention measures, vaccines and all of that, we may need to have some food supplementation available to the most vulnerable, people who have no income coming in, especially the nutritionally vulnerable. So we have the mix of vulnerable, because they're now people who are unemployed, economically vulnerable, mixed with the nutritionally vulnerable. So identifying, doing the analyses to identify where are the most economically vulnerable, and then identifying the nutritionally vulnerable in those areas, and making sure that we aren't missing the first 1,000 days and women of reproductive age getting what they need, so that we don't continue the cycle of malnutrition. And then care practices. Individuals, households, and communities need support during this stressful time. Local initiatives would be very helpful to engage children, give them some kind of activities during the day to keep them from going stir crazy at home. The routine of school is now lost, and so having interventions to support youth, supporting parents and caregivers with more, if they are employed, with more job flexibility, working unusual hours. If they are able to work from home or with technology, just giving people that flexibility because they've lost childcare, or they have children at home that used to be at school or at a childcare arrangement. Offering job security where people are concerned about going back to work because they may have diabetes or a pre-existing condition. They don't want to lose their job, but it's unsafe for them at risk of death to go back to work potentially. So having some mechanism of job security to the, where possible, and facilitate working from home. And that's what I have for this question.
Emily, I have a supplementary question to you. When you talk about the role of UN and donor and government, you talk about the budget allocation. But in practical situation, like I'm sharing with you the Bangladesh condition, this month just passed our annual budget for next 1 year. And we found that there is nothing related to the nutrition. They did not increase any money. Even they did not, accommodate anything for the nutrition. issues. They just given us some sort of money for the COVID management. It mostly for purchasing the instrument and other things. So how as a society we can advocate and to government to revisit this budget and invest more money for nutrition?
It's a great question. I think it's a women's rights issue. It's a children's rights issue. So I can see UNICEF being a strong voice, the UN organizations for women being a strong voice. FAO is producing a lot of policy briefs on what governments can do to address the pandemic. School children. It's hard to ignore school children, although it's hard to get them gathered together these days. And then local champions, if one can get the attention of a local hero of some sort to speak on the radio about UNICEF ambassadors might be great to use if you have some for Bangladesh or the South Asia region. I'll keep thinking. I'll send you an email if I come up with any better ideas. I mean, there also can be social media campaigns.
Thank Okay, Ted, just come to you again, and this is our last question for you, that as Emily mentioned about the women protections and other issues, you may award National Council. And this council, they have identified like 22 stakeholders, government stakeholders who will play and act for the nutrition. But during this budget, we did not see any reflection on these others, stakeholders like Women and Child Affairs or local governments. There is no allocation or increased allocation for nutrition issues. So my point is, how this can be, maybe this is the same scenario you may find in other developing countries. So how, as a civil society, we can act? Second point, how do you think that public-private partnership can be utilized to manage this nutrition during this COVID-19?
Thanks, Shamim. I like Emily, I'm a bit flummoxed. I don't really know offhand what you can do about the fact that nutrition always has had such low priority that when an emergency like COVID occurs, it's going to be forgotten and there's not going to be any money for it. And this in turn is going to lead to an assumption that the way to get at least some resources into nutrition is to turn to the private sector. I think that's a very dangerous potential solution. Emily mentioned that perhaps the private sector could provide soap and other things like that, and if they're willing to, without it turning it into a big PR exercise, I think that's fine. Anyway, let me just go through my points here about public-private partnerships, which are being promoted by Sun and others in recent years. I think that this is part of a much larger process of neoliberal and conservative forces attempting to reduce the public sector space, which they don't like, and increase control by the private sector, which basically means wealthy people in the countries they control are going to gain more and more power and more money and more control over our lives. We see this happening in so many spheres now. And they're trying to encourage governments to give up on many different policies that were in place to separate public and private spheres of influence, to bring them together, like you say, as if they're all just stakeholders with common goals, but they're not. back in Sweden, we once had a seminar run by an ethics professor on what should be the contact between the health sector and the private sector. And the basic conclusion of that day-long seminar was that, number one, if you want to have any contact with the private sector, you have to be sure that your goals are the same. If they're not, why on earth would you want to be collaborating? You're simply going to give them a chance to further their goals, and if they don't share yours, they're not going to make a contribution to yours. It's not their goal. Secondly, you have to make sure that they're not going to exploit you to achieve their goals without letting you know what their real goals are. And I think that governments need to be a little smarter now in resisting this push. So, in recent years, public-private partnerships are widely being promoted as a way to increase public access to private resources, but in reality, too often they actually function as a way to increase private sector influence over government actions that may impact on their businesses, doing harm to government actions that otherwise would be best for public health and welfare by regulating industry practices. Thus, the most honest and service-minded governments that I've had experience working with tend to maintain a distance from the private sector, especially in policy-making contexts. It's not difficult for governments to request the food industry to give inputs on scientific and regulatory issues when needed. For example, food safety, food recalls, food fortification, adherence to regulations like the Code of Marketing of breast milk substitutes. There's no need to say to government, oh, you have to involve the industry more. No, they don't. They can involve the industry anytime they want. They can call an industry for specific needs, and industry is going to respond. They have to. Thus, we don't need promotion of multi-sectoral stakeholder approaches, which, coming from international donor agencies like SUN, is too often a covert way of involving the private sector where it doesn't belong. In addition, the small extent to which the private sector actually makes additional resources available often functions as an indirect bribe. If you look at the budgets in the SUN business sector activities, the amount of actual money that private companies make available is extremely small. And it should be. It's not their job to promote health. It's their job to make money. And it's ridiculous to encourage governments to forget that fact. Thus, if professionals in the private sector, that means executives and businessmen, if they actually want to make a difference privately because they're concerned for their society and for people and what's happening with COVID, they can make personal rather than company contributions to government and charitable agencies because that's free from corruption. Why should their companies be the ones paying for charitable donations? They should do it themselves. Okay, I know that's maybe not what people are expecting, but that's my take on the issue of public-private partnerships.
You're muted, Ted.
I was just saying, you've got a couple slides we haven't seen yet, so I think we should turn over to letting you finish up instead of me.
Okay. I had one, but I put it in the chat box. Because I don't think I did not have all the same questions that you did, so I don't have the private sector question. I can touch on this, which I put in the chat box, which is roles of government, donors, and others. I forgot I had a second slide. I was trying to have one slide for each one, but providing access to credit facilities, low interest rates, special loans, and relaxation of terms of loan repayment. Everything ideally is more flexible given our circumstances right now. Cold storage facilities for farmers is needed because produce is having trouble getting to market and it's spoiling, it's getting wasted. In an online forum, there was mentioned that international organizations could do more local sourcing of foods if they're doing a school lunch program. I know WFP's been trying to do that, but other organizations that are promoting food related interventions could do more local sourcing of food or other commodities that are needed, provided that it can travel and get to market. Flexible repayment schemes or payment schedules for people who have loans. Reallocate unused agricultural or other funds to fight the effects of the pandemic, especially in rural areas. Regulating border flows, increasing access to testing. I know that's a challenge here in the United States. Don't know how it is in Brazil, but it's very difficult to get tested in a timely way and to even trust that your results are accurate. So we do need more support for that as the science improves, and then disseminating it out so we can control the spread of infection. Provide personal protective equipment to essential workers, public servants, medical personnel. Educating about the pandemic in schools, universities, extension programs, in-service trainings. I have a picture here of an in-service training in Kabul, and people are so close together. So now that we have trainings that may not be all online because we may not all have the technology for that, how are we going to continue to do in-service trainings and educating the public? We have the media, but we will have to distance work in smaller groups. But the role of government, donors, NGOs to manage nutrition-related problems is, it is related to educating and providing accurate information. I came across this picture, which people might remember from another health crisis, the 5 F's for diarrhea control. I put COVID-19 at the end of it, thinking that a lot of the solutions to preventing diarrhea.
You need to shift your slide on our screen, I think.
Did I shift it?
No.
Okay. Oh, maybe. Is it not showing up?
Oh, now it's showing. It's good.
Okay. So I was thinking that, this diarrhea control experience would be useful for us thinking about COVID-19, that we've faced something like this before, that hand washing would help prevent, that food hygiene would help prevent, water quality, contaminated fluids, all of this we've dealt with before. We have had success. So I think if we could end on an optimistic note, COVID-19 is different from things we've seen in the past in many ways, but we do have a lot of good, effective strategies for tackling these things. So I think working together and drawing from our past experiences, we can beat this. That's all I have.
I don't know if Shamim is able to get online. We've got Iftia and Angelina. I wonder if you two have any questions that you'd like Emily and I to address while we're still together online here. Either in the chat box or if you can access microphones. I've given you my email address, and you're certainly welcome to write to me if there's anything I can help with. I don't see myself as being a particular expert in this field, but I've been around for a while.
Well, they are both muted. You could unmute them and see
I
what
see
they
that they are.
say.
I don't know how to unmute them. They might be able to do it themselves, or it might require Eminence to do it.
Yeah. Well, perhaps we can, they can send their questions into Eminence if they want any more feedback from us on any of the different things that we've talked about. Thank you for their time, and for everybody who may be watching on Facebook that we can't see. Wide world of Facebook out there. We appreciate your attention and wish you the best in your efforts to fight the pandemic and improve nutrition.
Great, thanks. Ah, there he is. Hi, Shamim.
Sorry, Ted, I had I think you have already discussed lots of issue. I just want to mention that, you know, FAO, she just made a comment that the price of animal and food is increased in developing countries, especially Southeast Asian countries. Especially like, you know, those are producing chicken and milk, they are not getting the at the village level due to the transportation problem and others. So do you have any comments regarding this?
Well, I think we need to get away from, the whole world needs to get away from giant factory animal farming techniques. This is part of what's causing COVID and other diseases to transfer from animals to humans. It's also part of what's causing climate change. I think village production, which has been promoted in Bangladesh, of chickens and eggs, and where possible, animal milks. These things can be done. Small animals, in many developing countries, they're promoting rabbits and other small animals for more home and village level production. So as Emily said, maybe there's some opportunities here to move us in directions that we should have been going otherwise, but purely economic forces are forcing everything in the direction of giant international companies controlling everything. And I think that's, unless some efforts are taken and somehow, that's the future for even a country like Bangladesh, that you're going to have, just like the United States has, where they have, you know, 2, 3, 4 companies that control entire industries like grain production and marketing, seed distribution and selling. These things, as capitalism proceeds, are going to get more and more monopolized, and they simply put people at greater and greater risk. I would like to see the world learning from this, because it's going to get worse before it gets better. We're going to start seeing more and more global pandemics, because global climate change is just creating conditions of making it worse. And if we get a virus that's as infectious as measles, and infectious before you even know you have it, like COVID, it can kill hundreds of millions of people. We can have something like the Black Plague of the 1300s. And people need to start thinking about, what can we do to protect ourselves? You know, it's worth spending a little bit extra money to have local production of things, instead of accepting that you save a few dollars and you have stuff produced and sold to you by giant companies that control everything. In the agriculture sector, I'm just shocked at how easy it is for giant companies to convince farmers to go with hybrids and with GMO seeds and stuff like that, just because it increases production a little bit. It often gives you other problems. So, and all of these biofortified foods, they're not doing as well as was expected, because farmers in Africa and consumers in Africa don't want stuff that tastes different, is harder to cook, uses more fuel. There's all kinds of things that people need to keep in mind before adapting and adopting some of these foreign-based technologies. So local solutions need to be strengthened. We need to protect ourselves. Every government in the world needs to realize that food sovereignty should be their policy. Don't depend on imported foods, because if you do, unless you're a country like Korea that's got giant international companies, Korea can afford to import foods no matter how bad things get. But countries like Bangladesh might not be able to. So I'm glad you've got all your international clothing production and all the rest of it. But in addition, if I were in the government of Bangladesh, I'd be thinking about how can we get food produced and stored and sold in ways that protect people out in the rural areas when there are disruptions, because there's going to be more and more disruptions, not just from diseases like COVID, but from climate change. Bangladesh already has lots of systems because you've always been subject to flooding. Don't lose them, strengthen them. Emily, you must have something to add.
I had a lot of very enthusiastic children home, so I put myself.
Okay.
So, I mean, I think to wrap up, if we're doing concluding thoughts, I'll have to think more on what governments can do when the government budget is constrained for nutrition. But some of my take-home thoughts are, how can we, in the context of nutrition, support caregivers when the caregivers are most affected right now by COVID? So how can we support the caregivers, many of whom are women, but also the fathers? And I know in recent years we've talked about doing nutrition education, not just to the mom, but also not even to her mother-in-law, but also to the spouse, the husband, to other household influencer people. And this is a great opportunity to do more of that, because depending on who's sick or who's unemployed, or if the husband's unemployed and the woman has to go out and work now or do something different. So the husband might be now providing more childcare than he ever has before, because they're all trying to survive. Young children may be going out to work because they're at least risk. So child labor issues may arise. But how we can support caregivers and all household members with good nutrition information, and protecting the vulnerable during the first 1,000 days, and finding creative solutions, whether, in Bangladesh, it would be at the mosque, of having distribution of iron folate supplements on Fridays to the men when they come. I don't know if women go to the mosque, but they don't in Afghanistan so much. But if there's a way to distribute things, like Ted mentioned, you don't have to hand them off, but you could, space them out, and people could come up and pick up their package, for people with a pregnant wife, and they had to come with a doctor's note or something. But make sure that people are getting their iron folate during pregnancy. Creative ways to do vaccination campaigns where there's masks and distancing, and just the use of other community spaces. I know in New York City, they got creative using other spaces for hospitals, bringing in a ship or something too. But I think there are other community locations that can be used for services, especially, our houses of worship have been closed. So they can be used, if houses of worship are closed, for distribution or off times when there's not a worship service going on. So. Human beings are resilient.
Thank you, Ted. Thank you. So, Ted, thank you so much, for your time. Issues related to this nutrition. I think it will be great help for our country as well as for the developing. We'll keep into and our plan to continue this stakeholders, and hope that you will come forward to help us continue this. Thank you so much, Emily. Thank you so much.
You're welcome. It's a pleasure to be here together.